Welcome to this video on COVID-19, brought to you by the Public Health Student Association at St. George's University. Things are not yet back to normal, but we're here today to talk about a few things: boosting your immune system, improving your mental health, and Vaccines 101. One of the ways to have a healthy immune system is to practice proper sanitation. This includes proper hand washing, effective disinfection of objects, using hand sanitizers, and avoiding close contact with sick people. In order to wash your hands properly, perform the following steps. Wet your hands under running water. Apply the soap and rub your palms together. Spread the soap lather over the back of your hands. Make sure the soap gets in between your fingers. Grip your fingers on each hand. Make sure to clean your thumbs. Press your fingertips onto the palm of your hand. Dry your hands thoroughly with a clean paper towel after rinsing your hands under running water. Another way to have a healthy immune system is to drink plenty of fluids or water, 8-ounce glasses, and stay hydrated. This is especially important for people who exercise a lot. Water cannot be substituted for any other soft drink or juice. In addition, engage in moderate exercise, such as yoga, to improve your overall health. You should aim for at least 150 minutes every week. It's also advisable to have a workout plan that you follow. Additionally, having a healthy immune system requires maintaining a healthy, balanced diet that can include protein and plenty of fruits and vegetables. Some of these nutrients can be found in spinach, milk, broccoli, or eggs. Another way to maintain a healthy immune system is by getting enough sleep, at least 7 to 8 hours a night. This allows the body to rest. Overworking yourself and getting less sleep can lower your immune system and make you more likely to get infections. Less sleep can also make you feel tired during the day. Try to avoid fatty foods or trans fats like KFC, as this can lead to clogged arteries. Clogged arteries are responsible for coronary heart disease or heart attack. Finally, reduce or manage stress, such as excessive worrying, depression, and anxiety, by doing meditation, yoga, and/or music relaxation. Managing stress is important so you do not get too overwhelmed with schoolwork. Some other ways to cope with stress during COVID-19: limit social media or news exposure. Take care of your body, and connect with community or faith-based organizations. Now, let's talk about vaccines. Take a few seconds to think about why people get vaccinated. Getting vaccinated makes you a vaccine hero by fighting against evil and bad germs. Stay healthy and prevent outbreaks of vaccine-preventable diseases by staying up to date on all your vaccinations. So what are vaccines? Around us 24/7 are invisible bad creatures called germs that can invade our bodies and make us sick. Doctors give us shots so that our bodies can learn to recognize these germs and fight them off to protect us from getting sick. They can prevent a disease from occurring or drastically decrease the severity of symptoms and related complications. Here's a chart of the 5 different types of vaccines and the diseases they fight against. Think about if you have heard of any of these diseases before. All of the diseases mentioned here, except for the flu and tetanus, can be removed via vaccines. The system in our body that fights off germs and stops them from making us sick is called the immune system. It continuously produces antibodies. It's a working machine that never tires out and is currently working right now. Vaccines produce a primary response, seen in the first hump, by building up antibodies and memory cells against it, so that when the body encounters the same germ again, seen in the second hump, the antibodies and memory cells that the body has already produced can recognize the germs and fight them more quickly and more specifically to decrease the chances of you having symptoms or side effects. Now let's talk about some myths about vaccines. Myth: acquired immunity from a previous infection is better than immunity provided from a vaccine. This is in fact false. Some preventable diseases have drastic consequences that can be as severe as cancer, paralysis, or even death. Vaccines do not carry the same risks and act fast to provide protection from the diseases. Myth: vaccines, such as the flu, can give you the illness. Fact: vaccines contain a very small part of the virus or a dead germ that is virtually impossible to get the disease from. Any side effects or symptoms indicate that the body is working to produce an immune response against any future encounters with the disease. The vaccine is doing its job. Some people can't receive the vaccine due to medical and religious reasons. They may be allergic to some of the parts in the vaccine, or they're immunocompromised or have a weak immune system. This can only work if most people get their vaccines. This is an image of herd immunity. The person with the red umbrella is a person who is sick. The person who doesn't have an umbrella is an unvaccinated person who is protected by herd immunity, which represents the people with the black umbrella who are vaccinated. The germ will not be able to invade our bodies and will die out, keeping the people who cannot receive vaccines safe. You are the protectors and heroes for those who are not safe from evil germs. Interested in learning more about vaccines? Here are a few vaccine resources for more information. Please take a picture of the QR code to take the survey. Thank you.